So I'm going to do a quick run through of the procedure. Step one, once the patient's in the room, we'll do the block. So basically we're going to get the patient in the lithotomy position with the stirrups out. Remember, a blanket to keep them nice and warm. We will be placing the speculum. I didn't open anything. And then we're going to be cleaning off their cervix with a little bit of iodine, placing a tenaculum on their cervix. To do the block, we're going to do 10 mils of lidocaine or marcaine in a paracervical fashion, so 10 at 4 o'clock and 10 at 7 o'clock. And then the intrauterine lidocaine slurry, depending on what device we're using, the idea is it's going to be a thin catheter is going to be connected to some lidocaine gel that's going to kind of cover their uterus. So you can go ahead and place that in the uterus and slowly inject it. Some of it is going to flush back, but that's okay. That can be a little crampy for patients, but I just tell them as I'm doing it, like, this is what's really going to get you nice and numb so you don't feel anything. And then I take off the tenaculum at that point, put it here, and then we'll take this gauze, and hopefully you guys can open this for us, and we kind of just place some gauze into the vagina and then take out the speculum, okay? Then I recommend that you just raise the bottom of the bed and the patient can put their legs together and just lay down and relax, and then we'll leave. A support person can stay, and then we'll come back in 15 minutes to do the procedure. So for the procedure, we will take out the gauze. It's always nice to have a little kick bucket garbage right here. So, sorry. So hopefully a garbage will be accessible around us. And once again, we'll place the sterile speculum that's in the sterile set after we take out the gauze, and we will be using the tenaculum to place another tenaculum. At this point, the provider is going to assess how numb the patient is and how dilated they are. Sometimes you can tell that we're gonna be able to go ahead and just put in the catheter, so we'll place it. Sometimes we have to use the dilator to dilate a little bit, and at that point we'll really see how numb the patient is. Once we get them dilated enough to place the cannula goes into the uterus as you're placing traction on the cervix. Once it's in, sometimes you can get a little bit of blood that comes back, but what I do is I place that first, and then I get the suction device ready. So what you're gonna do is you're gonna flip the clippers to the end of it, and then you pull this back to kind of create a suction. And you have to make sure that the stands both come out. And then you can just attach the device to the suction here. And then to create the actual vacuum, you push the buttons back and you get a vacuum. Then what you can do, you're gonna notice that some tissue comes back. We slowly turn it and go back and forth, turn it and go back and forth. As long as it's coming, it's open, you can keep going. If I feel like something got stuck here, sometimes I'll take the whole thing out. If there is a lot of tissue stuck, you can use your little ring forceps very discreetly down here to get it out. Or you can have the MA fill up. We're gonna have some saline in a bowl over there. They can fill up the bowl with saline, and you can actually just aspirate a little bit of saline to get it out too. If I feel like we got a lot, but this whole thing is filled up, we need to do more, sometimes I just leave the cannula in there inside the uterus, and I take this out if this is kind of full, but I can tell there's more, and I will very discreetly push in like this and push the tissue into the specimen container, and be careful not to spill it. And then you can just get the suction ready again. Push, pull back, create the suction, attach it on, and keep going. And the idea is this is a crit. You want to kind of feel a gritty texture on all 4 quadrants. And then when you feel like you got everything, then you're done. Oh, one other thing on the setup, I forgot an ultrasound here. So we usually have an ultrasound, and we can do a vaginal ultrasound at the end of the procedure to make sure everything is done. So that's pretty much it for the procedure. Once we take off the tenaculum, we will need some silver nitrate sticks to make sure the bleeding is controlled. Then the procedure is done. We make sure the patient's comfortable. Again, take them out of stirrups, let them sit for about 5 minutes, and then we'll talk about the recovery.